Hello, everybody, and welcome to the Tuesday edition of Video Clips. And I have a couple of announcements, things coming up that you should know about. One is, for the first time, I'm teaching a mini class in clinical skills. This will be on February 16th, I believe at 7 p.m. Eastern time. It's a Thursday night. And I'm going to cover things like what to do with these people who have numerous problems. They've been in the medical mill for a long time, how to motivate behavior change, and this sort of thing. So if you're a clinician or you want to be a clinician and you're looking for creative ways to help people and take a different kind of look at health from our perspective, this would be a great class for you. I wanted to let you know our event on Saturday for the Food Over Medicine licensees and their guests was successful. I think this is really working out well, where we do presentations for our licensees out there so they don't have to do everything themselves. And we had a nice full room in our office as well. The next training, if you're interested in having an affiliation with us where you can offer our memberships and our products, and we will help you build a food forward business in your area. Next training is February 11th, 10 and 11. It's virtual live, and then there's lots of online coursework you can do. So if you can't do that particular weekend, we'll have other options for you as well. So send me an email about that. And then pay attention to our local stuff too. If you live in driving distance of Columbus, we have hot yoga, we have a gym, we have dinners, and we have a Valentine's Day wine and dine coming up, all kinds of local activities. So you can go to WellnessForumHealth.com and take a look at our offerings, or send me an email and I'll send you one of our calendars. All right. So today's topic is health anxiety. So a subscriber wrote this to me. My issue is health anxiety. Whatever ailment is going around, I'm bound to get it. It can be debilitating, racing heart, blood pressure rising, insomnia, the list goes on, but I wasn't always like this. If you haven't done a video on this, would you be willing to do that? So this one is a response to that. There are many reasons why people can be anxious about their health. An important one is that the medical profession and the drug companies benefit from your anxiety, and they've collectively organized medicine to be anxiety inducing. So I'm going to give you this is kind of a long video, but there's really significant stuff to talk about here. So it used to be that people went to doctors and visited them when they were sick to get treatment. Doctors knew their patients and their histories pretty well, and they treated conservatively. Conditions like colds and flu were not thought of as terrifying diseases to be prevented and treated aggressively, and often people were told that rest and time would make them better, and it usually did. Things started changing a few decades ago. Instead of waiting to get sick, how about preventing illness? Well, I think that is a great idea, and if it was implemented in a conservative way, it could have been a good idea. But instead, what took place was the development of what I refer to as disease mongering, changing the definition of disease so that even an abnormal blood test, a minor abnormality, was a cause for concern. Everything started to require treatment, not for illness, but for anticipated illness. And good examples of this are the pre-diseases, pre-diabetes, pre-hypertension, pre-osteoporosis. There's a pre for everything. Then the drug companies got involved in setting the diagnostic parameters for illness, and the criteria were expanded even more. Take blood pressure, for example. Normal used to be 120 over 80. Now this is considered pre-hypertension, back to the pre, and 110 over 70 is the goal. This and other goal markers are often almost impossible to achieve even for healthy people, which means more and more people are labeled as sick and receiving treatment for something. Well, how do people find out that they have all of these pre-diseases? Regular visits with doctors, more and more and more of them. Institutionalized medicine disconnected people from doctors with whom they had relationships, and the visits got shorter and shorter with doctors who were more and more distant from their patients. The bottom line, short visits without knowing the families and history of patients makes it easy to care for people based on lab results instead of nuanced decision-making that used to prevail. And I'll give you an example of what this looks like in real life. So I remember a few years ago, a woman came to see me who was 47 years old, in excellent health, normal weight, and her diet was great. And she was an avid fitness enthusiast. And so I said, well, what could I possibly help you with today? And she said, well, I'm a little concerned about my iron levels. They're low. I said, okay, when did this start? She said, in high school. And I said, well, can I ask why it's concerning to you now? She goes, well, it wasn't until my doctor retired and I got a new doctor, and this new doctor seems to think that there's something terribly wrong. And I asked her some other questions. Are you tired? Do you have anything going on that's concerning? No, nothing at all. Just this abnormal biomarker. And this had been built into a cause for concern. And this goes to the fact that lab numbers are reference ranges. They're not rules that, for everybody should fall within these ranges. And some people are a little high or a little low, and sometimes it fixes itself and sometimes it's persistent. But when nothing is wrong with you over decades of time, this is an example of how health anxiety can be induced. Well, the way this seems to many people as a result of what I'm telling you is everybody's got something and is being treated for it. And sooner or later, your number is going to be up. I'll add one more thing. The general practitioner kind of became the thing of the past, and more docs wanted to be specialists. And so referral to a specialist for more diagnostics became the norm for anybody who has a biomarker out of range. The extent to which people could be made to be terrified about their health was really brought to light when the COVID debacle began. A significant percentage of the population believed that they were at imminent risk of disaster due to the flu, and they were willing to do anything to avoid it, close their businesses, stay home, close the schools, close society, wear a mask, and agree to take an experimental product. The entire reason for getting up in the morning seemed to be to avoid disease, and that is an insane way to live. So years of training and indoctrination have led to this mentality. Human bodies are frail and vulnerable. It is so easy to get sick. Hanging out with doctors is the best way to avoid being sick, and doctors and experts know best, and we should follow their directions. Now, I'm going to add one more thing to this, and then I'm going to tell you some things I would advise you to do, and that's the role of expectation. So a few months ago, we covered a book, An Advanced Study, which is the series that we offer to professional members above, where we pick a book every month that we think you would probably get a lot out of reading. We assume you're not going to read it. We prepare workshops and we have discussions and that sort of thing virtually about the book. So the expectation effect, by the way, this week's book is Anxious Eaters, Why People Latch On to Fad Diets and that sort of thing. Very interesting book about the psychology of eating. But anyway, back to the expectation effect. So this is a book about just that, like you get what you expect, and that includes in terms of health. So the opening story in the book is a man who had cancer and recovered. And then he was told by his doctor that his cancer had recurred, and it was so aggressive that he probably would not live until Christmas. He actually did and died on New Year's Day. On autopsy, they determined that he didn't have cancer at all. He died literally of expectation. He expected to die, and he did. So this shows that a healthy person can think himself or herself sick. Lots of people do it. And for the person who wrote the email to me that inspired me to make this video, you're not alone, and it's incredibly by design. In the case of the guy who died of expectation, not cancer, it was a mix-up in the lab results or the images, but medicine is set up to induce you into thinking that you're sick. And back when I used to travel a lot, I remember getting off the plane at the airport, and immediately you're hit with signs about all the screening tests you're supposed to get at this center, in this medical center, in that cancer center, and et cetera. So what do you do about it? Well, the first thing is intervention. Cognitive behavioral therapy is an excellent form of therapy that can help you change your thinking about things quickly. We happen to have a great therapist. Some of you've taken classes with Kylie Rohrbaugh and become quite a fan of her work, and I'm a fan of her work. So that's the first thing I'd recommend. Second thing is get educated. Most people really don't know much about how their bodies work and their immune system functions. Learn how to have confidence in your body. It's one of the reasons I don't worry so much about getting sick. I know what causes health, and I do everything I can to keep myself healthy. And I also know what causes sickness, and a lot of sickness is easy to overcome. Get educated in another way as well. And that's the limitations of doctors and medicine. You are your best doctor most of the time, and you should be your own doctor most of the time. What am I going to do today to promote health instead of just waiting till something happens and then seeking medical attention? And learn to discern when it's time to seek care and when it's not. So I'll finish with just a short story about myself. So the last time I sought medical care was in 1994. I was bitten by a cat. And infection, the type of infection you can get from a cat bite is very rapid onset, and it can kill you. And I knew right away something was terribly wrong. And I got in the car and drove myself to an urgent care center and got an antibiotic. By the time I got there, my ankle was bigger than my thigh, and I was definitely in trouble. And the antibiotic saved my life. It was really time for intervention. But when I think I'm coming down with something now, I just think, oh, this feels like I could get a cold or something, or I'm just feeling kind of off. I'll just take an extra yoga class, get in that hot room and sweat. And it's amazing how much that just sets me back up for health. But the most important thing is I take care of my body every day. What builds confidence in your health is knowing that you're doing everything you can about your health. And it doesn't mean that nothing will ever go wrong. But what it does mean is that you know in your heart that you're doing everything you're supposed to do to be healthy. And so you can expect health. I expect health every day when I get up. I eat well, I'm hydrated, I exercise, and I take care of the other less concrete things in my life. I've got a great social life and good friends and work that's meaningful to me. I like what I do and hobbies and all that sort of thing. Those are the things that lead to health. And when you engage in those things every day, you get a confidence about your health. So to the person who sent the email, or anybody else who suffers from some of these things that I'm talking about, this is not an overnight solution to solve it. You're not going to flip a switch and tomorrow not be anxious, but you can over time not be anxious about your health and actually be quite confident about your health. And I hope that these tips help you do just that. All right, that's all for today. As usual, pass this on to anybody who you think might enjoy watching it, and I will be back to you tomorrow with more news.